The bone marrow is disease, the patient bleeds easily. Why? Because the platelet count goes very, very low. There is bruising, there is fatigue, and the most important is there is frequent infection because the immune response of the patient to fight infection is not there, and there is muscle weakness. How do we diagnose? First, we might diagnose with a bone marrow aspiration, where there is a needle, smaller bone needle inserted, and the bone marrow aspirated, or sometimes a bigger needle is put in into a biopsy. Now, stem cell and cellular therapy transplantation unit, commonly known as BMT or bone marrow transplant unit, is a specialized healthcare facility designed to perform life-saving hematopoietic stem cell transplants for patients suffering from blood-related disorders, cancers, immune deficiencies, and autoimmune diseases. Now, I will just impress on you that very few places have bone marrow transplant in India. Very, very few places. And very, very few places have state-of-the-art bone marrow transplant. Ruby will be one of the most advanced bone marrow transplant centers in India, and we want to give our services not only to Kolkata, West Bengal, but the whole of Eastern India and even the surrounding countries. The challenge is it requires a controlled environment where hematopoietic stem cell transplants and other cellular therapies like CAR T cell therapies are performed. So doing this is very, very difficult, very, very difficult. It's an architectural and construction nightmare because we have to make the rooms infection-free. That is the challenge, and hopefully Ruby has been able to do it.
Stem cell.
So the conditions which the highly specialized procedures used to treat are leukemia, lymphoma, multiple myeloma, aplastic anemia, thalassemia, and other immune system disorders. Now there are two types of transplants. Hematopoietic stem cell transplants can be autologous, using stem cells of the same patient, or allogenic, using donor stem cells. But both types requires a sterile, infection-free environment to protect the patient's compromised immune system during therapy. The biggest challenge is to keep the patient infection-free, because if the patient gets infection, the chances are high that he or she might die. And the other problem is these things, these type of bone cancers, the bone marrow cancers, blood cancers, happen in children pediatric population.